Hi everyone, welcome to My Baby Experts. We are here live. It's Thursday night. I know this is a different night than what we usually do. So hopefully you guys all remember to jump on with us. We're going to give it a minute. Can't wait to see you all. I'm just going to get my phone ready here because we have a really good conversation for all of you tonight. And I want to make sure that we get all of you on to not miss a thing. So first of all, hi everyone, I'm Shari Criso. For any of you guys who don't know me, and we do have a lot of new people who've been joining the Facebook page, it's been going up by thousands every single week. So it's super exciting, and especially because we've been getting people from like moms and dads from all over the world, literally, like all over the world. And it's so cute because I see all your questions, and what's so amazing is just to see people from all over the planet messaging and asking basically the same questions, sometimes with a little bit of more difficult English, but the same questions nonetheless, which is really the whole point of all of this, which is that we all are having a shared experience here, which is parenthood. Motherhood, fatherhood, parenthood. And that just leads us right into today's topic, which is birth experiences, something that as women we share, no matter where we are in the world, no matter what time during the world's history even, we are all sharing this experience. So it's a great conversation. Hi, everyone. Okay, see everybody jumping in, and I have like a little bit of a distraction here, so I'm going to just shut that down. There we go. So hi guys, hi. So today, like I was saying, we have a great show. It's called Birth Experiences, and I have a really special friend and guest sitting beside me here that a lot of you already know, but I want to introduce. This is Laura Kardos, and she's a great friend of mine. She's also a childbirth educator. She's also a mom of 3 daughters who are right there in the next room. So cute. And she's also the owner and inventor of the Back Buddy, the one that I always sit here with on my couch and you all love and know. So she's the person behind this amazing company as well. So welcome, Laura. Thank you so much for being with us again.
Thank you. Thank you for having me. I'm so excited.
Oh, me too. Me too. I was like, thinking like we've been working together for a long time now, like almost 2 years, and we've done a few streams together. Laura and I started talking about like, something in common that we both share is the fact that we both worked with pregnant moms, and through, the whole experience of childbirth, Laura being a childbirth educator, which she'll talk about in a minute, and myself, like I was saying, for those of you guys who don't know my background, I spent the majority of my career working with laboring moms as a labor and delivery nurse, and also as a nurse midwife, where I delivered well over 600 babies in my practice. And so I know a lot of you know me for breastfeeding, and I've been doing that for quite a while now, but really the majority of the time that I've been working with moms was through birth and the labor process. So when Laura and I got together to come up with a topic, we're like, we have to talk about childbirth, and we could probably talk all night. So we're going to have to get to the topics. But Laura, can you just a little bit, give us your background, tell us a little bit about how long you were doing this and your own personal parenting experience too.
Yeah. This is something that I hold very near and dear to my heart, and it's kind of what brought everything together for me. Before I had my twins, I went through a lot of the classes. I tried to learn as much as I could, but I never felt like there was enough information out there. And for me, I'm one of those people that likes to be prepared about everything. So I want to get as much information as I can so that I feel like I can handle the situation better. I know what to expect. And it kind of takes out a lot of the stress for me. So when I was pregnant, I took a lot of the childbirth classes. I ended up missing like the whole last section of the class because I was put on bed rest. So my poor husband had to go to these classes all by himself.
And just for the audience, you had twins with your first pregnancy.
Yes. So I was on bed rest from 26 weeks on.
Okay.
So it was a pretty long time. And he would come home with all of the information from these classes, and I would just start crying. I can't believe that I missed this. How am I going to do this? And he was great. It was wonderful because he got to learn everything too. He got to be a part of it. And I felt like that experience of being able to do that together was just so important. And then just to be prepared makes all the difference in the world. So after I had my twins, I knew immediately that I wanted to start teaching. And I became certified and I taught for almost 10 years until I started this business. And then, things just kind of got busy. And now that we're doing this, I so want to keep teaching. I love talking about this, and it's just so, so important. And it makes such a difference in parents' lives when they're prepared and they can go through that together.
Absolutely. I mean, birth is an experience that, regardless of what our deliveries are like, we will never forget it. So for some, it will feel like, a very empowering, amazing experience. For others, and I'm reading here in the chat room, some people will talk about their experiences being traumatic, which we will get to.
Absolutely.
Regardless of how it goes, it's something you won't forget. That's for sure. And I know as a midwife, it was something that I always kept in my mind when I was with women in labor was that, for me, I might forget about this night. It's another night I'm working. It's another patient. It's another person. And maybe in a year or 10 years, I won't, even though I never really forgot any of the births. But for that person, for that mom, that was a moment she was never going to forget. It was always really important to say the right things, to help her to feel good at every moment throughout the experience, no matter what was going on. And so I know so many of you guys here in the chat room who are watching this either now or on replay, you've got all kinds of different experiences. We all come out of this in different ways, and they're all valid. So we're going to go through some of the things that Laura just touched on, which is like, just being prepared and among other stuff that will help you to possibly go through this experience if you're pregnant right now a little bit easier, or to help you look back at the experience that you had and say, what could I do? What could I have done differently or do differently for next time that I didn't understand? Or just to come to terms with whatever did go on with your delivery. So that's what we're going to talk about tonight. Before we get started, I just want to get a little bit of a poll in the chat room here. First of all, I want to know if there's any new people. So if you're new, I want you to go ahead and type in "I'm new," because we love to welcome new people, and I know there's a lot of new people. So if you're new, go ahead and type that. And then also, I want to hear from you all. Let me know, are you expecting? Or did you have your baby already? Or, what brought you here tonight? What is it that you're coming to listen to? Are you planning another? I just want to hear a little bit about where you're at in this whole pregnancy continuum right now. So go ahead and post that in there. And then let's talk for a moment about the prize so that they know how to win a prize tonight. We are, like Laura said, her business right now is Back Buddy, and we're going to be giving away your choice of one of the Back Buddies. They're amazing. I have several of them along my couch here. We sit and they're kind of like into the couch, and I sit against them every day because they're so comfortable, whether you're on the couch, in bed, on the floor, it doesn't matter. And you can use them during your pregnancy. You can use them for breastfeeding. They're just a super comfortable, supportive pillow that will hold you up and support your back. So you could go ahead and just comment here, like or love the post. That's the way to enter. And I want you to comment at some point during the stream. Tell me what you love about the Back Buddy and why you would like to have one, okay? And then we'll pick a winner at some point in the next couple days. Yay. Okay. Hi, Beth. Bethany's new and she's due in 2 weeks. What perfect timing, Bethany. Welcome to the program. All right. So let's get right to it and talk about preparation, because that was the first thing that you mentioned, Laura, was preparation. Mm-hmm. So, and that was what you said you did for 10 years, helping people to prepare for this experience. What are some of the ways that would be great for parents to prepare?
Well, obviously, taking some classes definitely helps. I think it's important. It's important to read the books, and it's important to, find out as much information as you can. But it's also important to actually interact with people who have been through it. So I think that's where the classes really help. It just brings a different dynamic. You can ask questions, and you can meet other people who are going through the same thing that you're going through, and that makes a huge, huge difference. You'd be amazed at how much you can learn just by talking with other people. Yeah. And being there, and actually going with your partner and being there and learning all of it together makes such a huge difference. And then one of the other things that I think is really important to prepare, and for a lot of people who maybe, almost due or a little bit further along in their pregnancy, they might feel like there's not as much that they can do in terms of nutrition. But it really does help. And it seems pretty obvious, right? Like you're supposed to eat healthy during your pregnancy. But one of the diets that I always did a lot of research on, and I don't know if have you heard of Dr. Brewer? Do you know who Dr. Brewer is? Okay. So he was an obstetrician, an MD, who did all this research about diet during pregnancy. And even though it seems common sense that you should eat healthy during your pregnancy, it really does make a huge difference to make sure that you're eating all of the components of your diet that you're supposed to. And one of the big things that he always talks about is protein during pregnancy. You're supposed to be eating anywhere from 75 to 100 grams of protein. Well, he actually was able to prove that by eating that amount of protein in your diet, you can almost eliminate the risk of toxemia and preeclampsia during pregnancy. And a lot of people don't know this, which is always so shocking to me, that even the OBs just don't, it's not something that they learn during medical school. And that was one of the things that Dr. Brewer always said was, I didn't learn this in medical school. They don't teach us about this kind of stuff. So I think nutrition is one of the most important things that can help prevent, preeclampsia and toxemia. It can help prevent preterm labor or rupturing your membranes too soon. Making sure that you get all the fats and oils in your diet that you need, to make your membranes, more stretchy and able to handle things. Making sure that you're eating enough salt in your diet just so that you can accommodate the extra blood volume, things like that. But nutrition is one of the things that I used to always really, really, that was a very, very important part of my classes. It was one of the things that I always, and I hold people accountable for it too. I make sure that they keep track and that they bring their sheets in, because if you don't, you just won't do it. That's just kind of how it works.
And it's one of those things that you really have to make a conscious effort to do, because it's 75 to 85 grams of protein a day is a lot. It's more than most are eating. But you're right. It is something that's important to do while pregnant. The protein is the building block of everything that is building your baby. I mean, you eat that and you eat proteins. If your body breaks it down, and then it grows your baby and your placenta and your fluid, everything comes from that. So it's really important to make sure that you're eating well, and to also, keep track of it so that you know what it is that you're counting it, because it's a lot.
Absolutely. And for me with twins, I had to eat 120 grams of protein a day, and that was really tough. It's a lot.
What about exercise? Because I think that one too, I think that yoga, exercise, trying to stay as flexible as you can.
Absolutely.
Help really does help you. When I always used to say to my clients, my patients, labor is like running a marathon. I mean, like you're really training for a marathon. It's a very physical experience. And so the more, just like anything else, if you were going to go into it and, not train yourself at all, or get your body ready, it's going to be harder. And so doing any kind of, even if it's walking, stretching, yoga is great.
Yeah. Swimming, anything to keep you active and strengthen your muscles, because during labor, you need that strength. And building it up throughout the pregnancy is going to make the labor go a lot faster as well.
Absolutely. And one of the things that you could also try too is some squatting, because as in our Western cultures here, we don't squat very much. And when you look around the world, it's a position that people do on a regular basis, that they squat. And we just don't do that, but it's such an amazing thing to practice and to use for your labor, because the squatting position will actually help to open up the hips, open up the pelvis, and make more room. It helps your baby to drop down. And so getting into that squatting position, even if you can't balance yourself, but you can hold on to something and just start squatting, it is a position that takes a little bit of conditioning.
Yeah, and it strengthens the pelvic floor too.
Yes.
So I used to do it anytime I had to pick up something, anytime I had to clean something off of the floor. Instead of bending over, you should be squatting. You should be squatting as often as you can while you're pregnant.
Absolutely. Absolutely. And you'll be doing a lot of squatting once you have a baby who's a toddler on the floor. Squatting down with them.
That's
so it'll
right.
get for that too. I do see somebody asking, Joe he's like that, he's paying attention too. Cindy was asking, where can she get a back buddy? She needs one. Joe just posted up Laura's website there, a link to Laura's website, and also a special code that she gave all of you guys for tonight for 20% off the back buddy. So Joe just pinned it. Joe, rewrite it and just pin that, because you can't read that comment very well. So Joe will pin up the link and also the code for your 20% off. Good question, Cindy. You're welcome. Okay. Let's see here. Other things for preparation of childbirth is also like relaxation techniques, different, and depending on which class you take, there's going to be different methods. And I don't know that any one method is like the method to try, but there are different methods like hypnobirthing, Lamaze, Bradley, there's all kinds of different methods out there, but the important part is to do something.
Yeah, and I recommend researching the different methods and figuring out what is best for you, because not everybody relates to every single method out there, but really do the research and figure out what the difference is between them all, and figure out what you think would be a good fit for you, and then go with that.
Absolutely.
You have to be comfortable with what you're doing, and you have to have a plan.
Yeah. Speaking of plans, what about like birth plans? What do you think about birth plans? Have any of you guys in the chat room created birth plans for yourself, and what was your experience? You can go ahead and post about that. But what do you think about birth plans?
So I think it's really, really important to create a birth plan, but to keep in mind that it might not always go the way that you planned it. So make sure that you have an open mind. It's important to have a plan in place, and definitely make sure that you know what your preferences are ahead of time, so that you can communicate those to your birth team, because depending on who you're seeing at that moment, I mean, you may be with one doctor or midwife throughout your entire pregnancy, and then when you go to deliver, that person might not be available. And then to have someone that doesn't know you from the next person, and they don't know what your expectations are, I think it's really important to at least have that in place, but then to understand that not everything goes according to plan, and be ready to change according to your needs or the needs of your baby, because obviously the health of the mom and the baby is the most important thing.
Yeah, it's a really great point. And I'll tell you, this is how I felt, as a midwife with birth plans was, the birth plan, like Laura was saying, is really like an outline for you to kind of express your ideal wishes of like how you would like things to go. It gives you a reference, it gives your partner a reference to say, and gives you all the options to say, this is what I'm looking to do, so that even if you're not in the moment being able to think about the things that you would like to happen, your partner will have that to look at, or your doula, or your midwife, or your doctor. But it's also really, really important, and I'm going to really emphasize this, is that when you use that plan as a guide to what you desire, and it's good, but when you use it as something that you now need to enforce, or you need to, be worried about the entire labor, it can actually work against you. And I've seen this happen where so much of childbirth is about surrendering to the process. We do all these preparations and we try to create the environment that we want. And then, some of it is just completely beyond our control. Laura will explain some of her own situations, and me too. But if you try to manage too much, or you're trying to control the whole process too much, it can actually work against you. And I'm going to talk a little bit about that in a few minutes, about the kind of hormones that are secreted. There's actually a physiological process that takes place. So it's really important to create the plan and then kind of like put it there as a wish list, and also understand that your body's doing what your body needs to do. And like Laura said, we may not have exactly what we plan to have. We also have a really great resource that I want Joe to post for us too, because lots of times people say, I don't know what to put in a birth plan. Like, what would I even ask for? How do I even start this? And there's a really great form on Earth Mama Angel Baby's website where you can actually go on. It gives you like all your different choices and options. It's really awesome. And you could fill it out right online and then print it out. So Joe has the link for you guys to go on over there, and it's free. And you guys can use it as a reference point for yourself. And you don't have to check off everything. You just need to pick out the things that are most important to you. That's the best part.
Jillian made a comment, and she made a good point. She said to have a plan, that she had one and her husband knew it and supported it, and that's the key. That's a really good point to make, is that the people around you have to support you and be an advocate for you, because you're not going to be able to always say what you need or what you want. And so it's really important that the people around you know and share your birth plan, so that they know what your goals are too.
Absolutely. Absolutely. It's probably the most important thing, not just for your partner to be on the same page with you and to be able to advocate for you, but also your practitioner, and I used to get this all the time. After I stopped practicing as a midwife, I had a retail store with, and I became a lactation consultant, and I had moms and dads coming into the store every day to buy products from me and talk to me. And they would come in, of course, after their babies were born, and they'd say, oh, this happened and that happened, and my doctor, and what could I have said in that moment during the delivery or, in labor to have changed the outcome? And my answer was always, not much, nothing really. There's not much to say, because at that moment in the middle of your labor or your birth, you really can't be your own provider. You have to kind of trust the person who's taking care of you to make those sometimes life and death decisions for you. And so I always say, the time to make those choices is not or time to have those conversations or to think about it is not during labor or birth, but way before. When you're pregnant, when you're choosing your provider, up until the very end. I had people who would transfer into my practice a week before their due date. And they would say to me, I thought that I was okay. We finally started talking about what we wanted. We're not on the same page. I'm really fearful that I'm not going to get what I want. We don't agree. I don't agree with my physician. I want to transfer. And they would say, it was always funny because they would call me and say, how late do you accept patients? And I'd say, is your baby out? And they'd say, no. And I'd say that it's not too late. You can still go. And so a lot of people don't realize that they can transfer that late in a pregnancy.
Yeah.
As long as the baby's not out, you can transfer. So let's talk about that for a moment. I know I'm skipping over right here, but let's talk about how to choose the right provider for you, because I think it's a really, really important point. And so, you can really transfer providers. And, some people do choose to see a physician, an OB. Some do choose to see a midwife. It's different kind of care for the most part. Depends on the person too. There's, doctors who practice like midwives and midwives who practice more like doctors. So you really got to get to know the person that you are going to see, and also what kind of practice you're going to. With my practice, I was the only person who delivered my patients. I took very few patients, and then we developed a relationship, and I was there for all my births. That's kind of uncommon, but usually you'll find either a group that will, rotate. You want to get to know everyone, because the worst is when you just want one person and they're never the person on call. Right?
Yeah, in my own experience, I had an OB, and I wanted to deliver in a hospital because I was having twins, and I felt like it was a little bit of a higher risk. And at that time, one of the babies was breech. We knew one of the babies was breech. And I went through my whole pregnancy with this doctor, and every visit I would tell her, I heard that if one of the babies is breech, we can still try to deliver vaginally. And she was like, yes, we can try that. Well, we get to I don't know how many weeks along I was, pretty far, and my husband's there at the visit, and I started, talking about the same thing that I had been talking to her about the entire time. And she goes, oh no, we're doing a C-section. And I was like, wait a second, do you know me? Like, have I not been here the entire time? I just told you I don't want a C-section unless I absolutely have to. And it was like, it just completely changed. And here I thought, she was on board with me the whole time. And then at that point, I actually did try to change providers, but nobody would take me. So because I was having twins, maybe. So I ended up having to deliver with a doctor that I didn't feel particularly comfortable with. And I'll share that whole experience later too, if you want me to. But I think it makes all the difference in the world, having somebody that you trust and that understands what your preferences are.
Yeah, absolutely. And I'm reading the comments here. I had Katie said she had a midwife that delivered in a hospital, and it was great. And I think that's where, again, I delivered all my patients in the hospital. You can have different kinds of experiences. It's really important. This is part of the planning, is to do the research, to learn as much as you can. So many times we'll hear people talk about, I had this awful experience. I never knew that I could have a midwife. I never knew that I could hire a doula if I was in a hospital, just from not knowing. And your first delivery is not like your practice one. It's not like, because I hear that all the time. It's like, maybe the next time, like with my first, this is not your practice run. This is probably going to be, if you're going to have a labor or a birth that takes longer, this is going to be the one. It's usually the first. It's also going to be the experience that will probably stick with you, because you'll carry it through your other labors as well. It's not a practice run. This is the real thing, and it's important. And it's important to set yourself up. And if you're not happy with who's with you, I think that's the number one thing. Honestly, speaking from someone who delivered babies for a long time, if I had to think of the number one thing that would most impact your birth, it's having the right person with you.
It's your birth team.
Your birth team. Like, I can't think, things even when you need to have a C-section, okay, even when you need to, even if things don't go as you planned, even whatever it is, having the right team around will help you to still have a positive experience.
Yes. Because even when things don't go the way that you planned, you have to try to make a positive experience out of it. And it is, as long as everybody's healthy, that's the most important thing.
Yeah, absolutely. One of the things I do want to talk about, and for years and years, Joe and I taught childbirth classes as well in our store. And our classes were a little bit different in that we talked more about the aspect of partnership. Joe taught a great childbirth class. We taught it to couples. So we taught it as a couple to couples. And the class was called Surrender. And what it was all about was learning about the the aspects of surrendering to the process so that you could have a really good experience. And what I mean by that is, birth is a physiological process, and our mind and our body are completely connected. And what winds up happening, and this happens to all mammals, okay? We're mammals. Other mammals in the wild, this is what happens to them too. When you are in labor, there is a hormone called oxytocin, and that's the hormone that is causing your uterus to contract, that's causing your labor. What works against oxytocin is a hormone called, God, my brain just went completely blank. It's the fight or flight response when you have adrenaline, okay? So adrenaline that runs through your body when you go into that fight or flight, adrenaline works against oxytocin. And a lot of people don't realize that there's an actual link between adrenaline and oxytocin. So what does that mean for you in labor? That means that just like animals in the wild, they're able to put off their labors for weeks at a time if they don't feel safe. So say you have an animal that's out in the forest, okay, and they don't feel, and they start to labor or they need to deliver their baby. If they don't feel safe and secure, or they feel frightened in any way, the body has a way of releasing adrenaline, which suppresses oxytocin, and you don't go into labor, okay? That's great for animals because they're afraid they're going to get eaten, okay? But for us, it's a little bit different, even though those hormones are still working the same way. Fear, feeling unsafe, feeling scared, all of those things can cause your body to also release adrenaline, which can stop your labor. And you'll hear about this all the time where, you may be laboring at home and everything's going really well and your contractions are happening and things are progressing, and you're in the safety of your own home and your own environment, and then you go, okay, it's time to go, and you get in the car and you go to the hospital. And a hospital, it's a scary place. It's every other time you've been to a hospital, it's because something bad is happening, okay? There's bright lights and there's lots of people and there's things happening. So you walk into that hospital, and the first thing that can happen is your adrenaline goes up because of the fear. When that happens, labor stops. And that's why you'll see moms who go in, everything's going fine, and then they get to the hospital and labor just completely stops. All right, that's what's happening. And so when you understand that process and understand that that's normal physiology of our bodies that actually is there to protect us in some way that can work against us, you can start to prepare by relaxing and understanding how to come down from that fear. And your partner can really help you with that too. So when we talk about relaxation techniques and we talk about breathing, or we talk about visualization or anything like that, it's to help to bring down that fear level and also to relax our bodies so that we don't tense up, okay? Tensing up causes more pain. And so what you want to do is you want to bring down that fear. When you bring down that fear, it starts it gets the contractions and the labor going. And when you relax your body, it stops fighting against the pain, which actually reduces the pain. So that was a lot said in one time, but it's really probably one of the best things, and why we say that there's not one method that works. It's whatever causes you to feel relaxed and causes you to feel less fear.
Right. The fear causes tension, tension causes pain, and then the pain causes more fear. So if you can control that and understand what's happening and know how to cope with it, then it's going to make your labor go a lot faster because it's more effective. Wasting a lot of energy tensing up. If you can kind of tune in and concentrate on what's going on and you know how to cope with it, it will help it go a lot faster.
Absolutely. And having your partner recognize certain looks on your face, when you're tensing or when you look afraid, to help you to focus on your partner or help you talk you down from that will really help you to relax. I think that it's really important to, some people feel like they get afraid to learn too much, like it will scare them more. But I think when you know more about things, you can understand when something normal is happening, and that can cause you to not be so scared. So if you understand the process.
That's a huge factor. In fact, I know from personal experience that happened to me. And just to give you kind of a brief overview of how my labor went, I was actually supposed to go to the hospital for a C-section because, I had this doctor I couldn't switch from. She swore that we were going to have a C-section. And I was in a lot of pain the night before. And I thought, well, if I'm going into labor now, I'm just going to wait until the morning because I'm scheduled to go in the morning. And labor's good for the babies. It helps stimulate the nervous system, helps dilate the lungs for when the baby's ready to come out. It's kind of good practice. It's really actually good for the baby. So I'm like, well, if I'm in labor, I'm going to stay in labor and I'm just going to go in the morning when I'm supposed to. Well, it turns out that pain that I was having overnight was my second baby turning. I have no idea how she had room to turn, but I get to the hospital and they get me all ready for the C-section. And then they're like, both babies are head down now. What do you want to do? And I was like, well, of course, we're here. We're going to do this. So they broke my water. I immediately started having really hard contractions. I was at like 1.5 centimeters when I got there. And I went from 1.5 to 10 in about 4 hours. It was really, really fast and really, really intense. And so when it goes that quickly, it's kind of scary. It comes over you really fast. I was in a lot of pain. And once I realized where I was at in the labor, I remember looking at my husband saying, I don't know if I can do this. And he's like, they're going to come in and check you. He goes, you could be at like 3 or 4 centimeters already. And I looked at him and I said, if I am at 3 centimeters, there's no way, like I cannot go on. And they checked me. And at that time I was at a 7. And so in my mind, I was able to recognize that it was like textbook transition stage. 7 to 10 centimeters, I started doubting myself. I started wondering if I could do it. I just it's kind of like an out-of-body experience. But when they verified for me, I think I was like 7 to 8 at that time, I was like, okay, I can do this. I only have a couple more centimeters to go. Had I not known that, that was a normal response during that time, I think I would have been even more fearful, and I don't know that I would have been able to handle it well.
Yeah, absolutely. I think that knowing what's going on, knowing that what to expect, even understanding things like what does it mean to be dilated 4 centimeters? What does it mean to be faced when they're calling off numbers and they're like 3, 50%, -2, like what does that even mean? It can be really scary if you're not understanding what's happening. And so I'm a big proponent of learning as much as you can about the process so that you understand, if you have some bleeding, that's actually a good sign, that means that your cervix is dilating, that, so that you're not actually getting more scared by it.
Yeah. Mm-hmm. And you know how to handle it too in certain situations. I've had students who have, their water breaks, and if you call the doctor and you go,
do you have the headset there? Because I think you're echoing a little bit.
Am I echoing? I'm sorry. Yeah.
A little bit. Yeah. It's okay. If you put those on, it'll make it easier.
Let me try.
Yep. I think that one of the things to really realize too, when it comes to the whole idea of pain during labor, is that there's a big difference between, and I believe this strongly, between pain and suffering, so when it comes to birth, it's sort of like there's really not another time in our life where pain is actually a good thing, where pain is actually telling you
pain is progress.
Yeah, it's progress. It's moving along. It means that your body is working the way it's supposed to. And when you can kind of understand and like come to like that realization and be with the pain and like work with it instead of tensing against it, it really does go faster and it makes it easier to tolerate. You can have pain, but you don't necessarily need to suffer. And I think that's a big distinction that sometimes we never hear about. But
Right.
pain can be really, I see they're putting in here, pain with a purpose, pain powerful. Yes, it's true. It's totally true. It doesn't need to be a suffering situation. Are you having trouble with your headset there?
Yeah, I have to see where I can even plug this in at.
That's okay. Don't worry about it. Don't worry about it. Are you guys hearing an echo, or are you guys okay in there? I don't know. Joe said he heard an echo. I heard a little bit. Echo. Yeah, it's okay. It's okay. I think
Not
that
used to this one.
What?
I'm not used to this one. I have to figure out where I plug it in at.
It's okay. That's okay. Yeah, she said they're saying it's better now.
Okay.
Yeah. So when you were talking about your birth with the twins, so you wound up having a vaginal delivery with the first one and then a C-section with the second one?
Yes, unfortunately. After the first baby came out, my second baby turned. She was the one that was breech the whole time. And so apparently she felt like she had a lot more room in there after the first baby came out.
That happens often, yeah.
And even though it wasn't an emergency, she wasn't showing any signs of distress, but they just couldn't move her. And in fact, my doctor tried to turn her and she wouldn't turn. And they said to me, the only way to get her out right now, she was transverse.
Yeah.
Spine down. And the only way to get her out is by C-section. So it wasn't ideal, obviously, to have birth both ways. And especially after going through the entire labor and delivering the first baby, then to have to go through and have a surgery, it was pretty difficult, especially for the recovery. But, I think that all of the preparation that I did beforehand made a huge difference because I knew at that point that I had done everything that I could.
Yeah.
And I was still happy with the outcome. I wouldn't have changed it, anyway, even if I could.
Yeah. And boy, did that make you way more prepared to support other parents too, I guess, for their births, having experienced both a vaginal birth and a C-section, having been through it all.
Yeah, absolutely.
Yeah. I only had one other patient that I actually had that happen with me, a twin birth that I did where we delivered the first baby and then the second baby turned. And we wound up doing a C-section on the second baby. And even then, she was so grateful just because she knew that, we tried to do what she wanted. And so even having, to go through both of that, which is not, like you said, not the ideal experience, there's still a feeling of empowerment of knowing like, when you got the best chance that you possibly could to have everything that you wanted.
Yeah.
That was actually the number one question that I would ask all of my patients who did have C-sections. I had a pretty low C-section rate. I did a lot of VBACs in my practice and had very few C-sections. But when we did, the first question I would ask when we'd be in the recovery room was, how do you feel? How do you feel about the whole experience? How do you feel about your birth? And almost all the time it was, I feel great. I feel like we did everything. I felt like I was part of the process. I feel like it was part of the, the decision making. It was always really important to me to make sure that mom had as much say as she possibly could in what was happening and that we could make that decision together to say it's time,
And I think it's important to note that even with a C-section, you still do have a lot of options and you can still make it your own experience and you can hold the baby right after the birth. And in most cases, you can hold the baby during recovery and you can nurse right away and you can still make it the experience that you want and still be a part of it, with the exception of an emergency. It can still be, what you had hoped for. And like you said, I just wanted to know that I did everything that I could, and that we made those decisions together.
Absolutely. Absolutely. We had, I've had a few really amazing videos that I found that I've been posting on my Facebook page about gentle cesareans too, that they've been, doing now, which I think things have come so far in the last like 20 years, especially, where, moms and babies can do more skin to skin right there in the operating room, where the whole process can be the birth that it is, because it is birth. And so even when you're having a C-section, you're still giving birth, regardless of how that baby comes out. And to make that experience beautiful, because it is beautiful, make it a beautiful experience for you.
It is. And my youngest daughter was born by C-section too.
Yeah.
And I wouldn't have changed it. It was just the way it had to be, I guess.
Yep. Totally. Yeah, I had both of my daughters vaginally. I would say with the first one, things didn't go as expected, because I was planning on having a home birth. I was planning on delivering completely naturally. I was a midwife at the time, and I had all these, plans. But the thing that I think was the best thing that I did was plan for all possibilities and knew when it was time to change plan. After many hours of having my water broken, I think my water was broken for over 12 hours, and I wasn't really progressing any. And it was about making that decision to say, okay, I'm on to the next part of my plan. Things are not going the way I expected. And now my plan has changed from wanting a home birth to wanting a vaginal birth. And knowing that it was time to go to the hospital, it was time to, get some antibiotics and to make sure that no infection was starting. And I knew enough, obviously, being delivering babies, but it's important to have a provider who's going to say to you and be honest with you to say, now's time for the next part of the plan so we can keep moving things in the right direction. Just avoiding everything is usually not the answer. So,
right.
Yeah. Couple things that I think would be really, really helpful is to understand the role of like water. I think that's a really great thing to know for labor, is to know how much that really helps with labor. And it doesn't have to be a tub. It can be a tub. It can be a water birth. It can be just laboring in the water, but also just water as far as like showers, standing in the shower. Like that helped me so much with both of my labors, just to get into the shower, use let the water run on my back, run on my belly. And I just remember, especially with my first, I was in labor for such a long time, standing in my shower, for hours. Like I'd get in and then I would feel so much better, and the contractions felt so much more manageable. And then as soon as I'd get out, it was like stepping off a cliff. I'm like, oh, that really, I'm going back in. I was so wrinkled. But I felt so much better. And I know with my own patients, like just letting them just stay in the shower for hours till they felt like they needed to push.
Yeah. The water is a huge help. And most hospitals will let you labor in the tub if they have one, but not all of them will let you deliver in the tub.
Yep.
So
and not everybody likes to deliver in the tub anyway. Like I had, you really don't know. Like you kind of leave that open. Some people like to do their labor, and then they're like, I had a lot of patients who are like, I got to get out to birth. And getting out to birth. Many of the hospital beds too will allow for different positions. And I think it's important to know that, being flat on your back is not necessarily the best position to labor in or to deliver in. And these are some of the things that you want to look up and talk to your provider about. I delivered a lot of babies while they were squatting, where I just got down on the floor, or we lifted the bed up and they were able to squat and delivered that way, or delivered on their sides or on their hands and knees. There's so many different positions that you can deliver your baby. And again, this is why we said before, it's going to come down to your provider being your partner. It's like you've got your partner, you got your birth partner, your husband, your partner who's with you. But then really the partner in your birth is going to be the provider who's actually going to be delivering the baby, so that they can work with you, preventing.
There was a question.
Yeah.
Oh, go ahead.
No, go
There
ahead.
was a question that came up from Molly that said, how do we get providers to allow you to hold the baby after C-section? Same thing, talk to your provider beforehand. Make sure that they understand, what it is that you're looking for out of the experience, and make sure that they're on board. And sometimes I think it's also the way that you ask them.
Yeah.
I always used to tell my students to word things the right way when they're asking for requests. Instead of saying, I want this and I want this, it was more like, this is what I'm looking for. Can you help me?
Yeah.
This is the experience that I want. Would it be possible to do it this way? And most of them, are pretty accommodating when they can be. But, if you're, like you said, a partner with them and you're there asking questions and, they understand that this is what you want, but you're also respecting their position and that not everything can go as planned.
Yeah. It's also going to give you a lot of insight too. If you're in an office visit and you're talking about something like, not doing a routine episiotomy, for example, and you're getting any kind of pushback against that now, don't expect things to change while you're in labor. These are all your clues. These are your clues to say, hey, this person's like already not like on my page. It's not like it's going to go away or it's going to get better. That's a clue to you to say, maybe I'm not in the right place. We are not on the same page. And that's why it's important to bring some of these conversations up early on in a pregnancy. Don't wait till the very end. And I think that's a mistake a lot of people make. And sometimes it's because their doctors are saying, we don't have to talk about that till later.
Right.
Bring it up and find out and say, no, I want to talk about it now, early on in the pregnancy. These are my thoughts. These are my ideas of how I want my experience to go. Are we on the same page? And find out, because that will give you way more time to evaluate if you're in the right place. That happens all the time where it's kind of pushed off either by the mom and dad or by the provider.
Yeah, definitely. And it's important to ask a lot of questions early on.
Yeah. And if they don't want to answer your question while you're pregnant, that too is a sign.
That's a sign. Yeah.
That's a sign. That's a sign. Why is this all important? Not only will it be a memory or an experience that you're going to look back at and hopefully treasure, but it also can cause, traumatic experiences during birth can cause problems for you postpartum. And, sometimes it has to do with the way the delivery went. Oftentimes it has to do with the way that you were treated or the way that you were ignored or the way that you weren't respected. Sometimes those things are the things that cause the most trauma. And so you may not have had a C-section, but the whole experience could have been something that traumatized you just because you felt like you were not treated the way you wanted to be. So it's important. These are the kind of things that can lead to postpartum depression. They can lead to fears about having more children. It can lead to issues in your relationships, whether that's with your partner, with your baby. It can interfere with breastfeeding. It can interfere with that initial bonding. And so, especially when it comes to postpartum depression, it's one of the big factors. We had a whole show about postpartum depression a few months ago. And it's one of the big factors was having a traumatic birth experience can really trigger that in women. And so, when we talk about how to prevent these type of things from happening and also how to create the best transition to motherhood, to bringing your baby home and having that experience be the best that it possibly can be, preparing for the best birth experience is the beginning of it. The pregnancy and the birth will lead into the postpartum experience. And so it's all one continuum. And so it's not something you just kind of, you do and put behind you. You will have to cope with that.
Yeah. One of the other things too is that we do so much preparation for the birth and we think of it as almost like an endpoint. And I know when I was pregnant, I was doing all kinds of research on pregnancy and labor and delivery. And then you just kind of think everything's going to fall into place after that. and it doesn't always. So you really do have to kind of look ahead. And as much as it seems silly to think about, you know, what's going to happen after the birth, you kind of just think it's going to happen on its own. But you do have to learn, you know, take the steps to learn about breastfeeding, to go to the Leche League meetings, to make the contacts that you need during the pregnancy, because once the baby gets there, you're not going to have time to be searching for people's numbers or knowing who to contact or doing any research. You're going to be pretty busy. So make sure you have that in preparation also, you know, knowing who to contact and who to reach out to for help when you need it.
Absolutely. Absolutely. It's so important to have those resources set up, support groups, lactation consultants. Think of all the things that you'll be needing to deal with once, and even for yourself, like having meals preparation, like things to prepare because you're going to be tired. All the things that you can make it easier for you so that if you come home and you're just can be with your baby and you're not you know, struggling to find someone to help you, or and make sure
and accept people's help. That was my big mistake. I'm one of those people that likes to do everything myself, and I feel funny about people doing my laundry or making me dinner or whatever. Just ask for help and take it.
Absolutely. Absolutely. No, this has been such a good conversation. I know that there's so many moms who, you know, beyond just going through like specifics on how to breathe or how to relax or how to, you know, it's not about the specifics. What this is about the awareness. This is about being more aware to if you're watching and you're thinking, okay, I need to ask more questions. Okay, that visit I just had with my doctor, I know in my gut, like that didn't feel good. Okay, that didn't feel good. Or my last delivery really just didn't go the way I planned it to go. And what can I do different this time so that I have a different experience? That's what this whole conversation, I hope, sparks in everybody, is just to kind of give it a little bit of thought. And if you know someone who's expecting and you know, go ahead and share this with them. You know, share the video, share the conversation. You know, give them that information that they need, because as new moms, like Laura said, and I know that this is what we all do, is when we have no children, we think of the birth as the end. We've gone through the pregnancy, the birth is the finish line. And actually, it's the starting line. And, you know, there's a whole other part that comes after that, which is being a mother and bringing that baby home. And it was only after I had my own children that I realized that birth was the beginning and not the end, like you said. And, you know, you're preparing for the beginning of motherhood is what you're really doing. And the birth is really that beginning.
The easy part.
It's the part that goes the fastest, actually. Even if you have a long labor, it's still over with pretty quickly. It's really like a day or two. Unlike, you know, what's going to happen once the baby comes home. And then for the next 18 or years or the rest of your life, actually.
Yes.
Oh my God. So you guys, if you want to win the back buddy tonight, and this is Laura's company, and she's the amazing inventor of this fabulous product that I have behind me that I want to show everybody what it is. It's so comfy. Okay, so this is a back buddy. And you can see I hope you can see it. This is kind of the shape of it. It's really super comfortable. It's got amazing lumbar support and side panels that help support the sides of you. I'm talking about your product here, Laura, while you can describe it yourself. And now I'm stuck. Hold on. And it just totally helps you like get into perfect positioning. I would say bring it to the hospital, right?
Yeah.
Use it right there in your hospital room after you have your baby.
There are some hospitals that use them. We have like a medical grade back buddy that they do use them during labor and delivery, and then also when they're trying to teach new moms how to breastfeed, because a lot of these new delivery rooms don't have hospital beds like we're used to, so there's really nothing to support the mom. Yeah. They're basically like queen size beds that they have in these natural birthing suites, and so it's really important to have that support behind you during the labor, and then especially during breastfeeding too.
Yeah, totally. Totally. Well, if anybody wants to have one, first of all, if you comment here, you may win one. But you can also go over to Laura's website and use the code that Joe posted up before for 20% off. We'll leave that up for a little while for anybody who wants to get themselves a back buddy. Laura, thank you so much for doing this with me tonight. It was so good to spend time with you again and to have this conversation. I love talking about birth. This was an amazing opportunity to be able to do that. And I hope that we made a difference for all of you guys tonight, just to be in the conversation. And if you're planning and you're pregnant right now, we wish you the most amazing experience and so much love. We're right here behind you, and hopefully we can support you right through it. So have a good night, everyone. Thank you, Joe, for commenting here for us and posting everything. And Laura, thanks again for being with us.
Thank you.
Okay. Well, go enjoy the rest of your vacation there.
My vacation, yeah. Thank you.
On vacation. She took a break to be with all of us. That's pretty cool.
Yeah.
All right. Good night, everybody. We'll see you soon. Love you. Mwah. Bye.
Thank you.